Hi, this is Dr. Prasad, prosthodontist and implantologist, KIMS Hospital, Secunderabad and Kondapur branch consultant. Today we are discussing about the wisdom teeth and its complications and where are all the areas it is the importance of wisdom teeth and complications of implant. Wisdom teeth. Usually the teeth erupts, all the 28 teeth will erupt before 18 years or before 14 years itself all the teeth will come in a line. After that, from 18 to 21 years, the back last molars will erupt. They are called as a wisdom teeth. Why they are called as a wisdom teeth? Because 18 to 21 is the graduation period for all the kids. At that time, we are going to acquire lot of wisdom. So, for that purpose only, we derived that name as a wisdom teeth. Apart from that, there is no correlation between wisdom and that teeth. What are all the complications we are going to face if the wisdom teeth is not properly erupted? Normally it should erupt, but nowadays only 28 teeth are erupting properly and the jaw is accommodating for 28 teeth, not for 32. Because of so many years we are not consuming the hard foods, we are eating only semi-solid food, so the jaw got a little bit constricted and only it is accommodating 28 teeth, and the last teeth which is coming 18 to 21 years, it is unable to accommodate. So what will happen? The first and foremost thing is when it is trying to erupt, it creates infection on top of the, it is coming below from the bone towards up. So on top gingiva is there, the food will get entrapped and gingiva will become infected. And sometimes if the gingiva will become swollen and opposing teeth will cause damage to the underlying gingiva. This is the first and foremost thing. And the second problem is when this is like this is a normal teeth and this is the impact teeth. It is slightly inclined towards left, right or back and all that. Because of the inclination, what will happen? Whenever you eat food, it will go and entrap in that area. Immediately it creates an infection or it creates a decay. That is the second thing which is caused due to the impacted teeth. And third one is impacted, it will try to erupt out. When it is trying to erupt out, it creates pressure on the neighboring teeth. When it creates pressure on the neighboring teeth, it tries to damage the neighboring teeth, which is the neighboring teeth is the major teeth which helps for our mastication purpose. So that is the third one. The fourth one is it causes impingement on the underlying nerve, which again causes a little bit partial loss of sensation to the lower jaw. Fifth one is if it is unable to erupt and any cyst cause on top of that, it creates a lot of infection in that area, that is called as a cyst. Cyst will convert into tumor and sometimes the cellulitis and or the swelling, pus, these are all the complications will occur. What are all the clinical symptoms? Symptoms means the first thing is pain. Whenever you feel pain, swelling, pus discharge and unable to open the mouth, that is called as a trismus because infection in the muscle or it is obstructing the movement of the condyle. All these things are the clinical features where immediate attention is required for the wisdom teeth. And what is the treatment part of the wisdom teeth? Only this thing is the simple extraction or surgical extraction of the wisdom teeth is needed, because if the wisdom teeth is underlying the bone, we have to do surgical extraction only. Surgical extraction previous days is a little bit difficult thing because we don't have an idea exactly how it oriented. But now with the help of 3D scans, everything is just in our hand itself. We can able to see how everything is located in that area and easily we are removing. And now with the help of a piezo equipment, without damage to the neighboring teeth, we are removing the wisdom teeth very easily and slowly. So don't worry about the removal of the wisdom teeth. It's a surgical procedure. Better as soon as possible, once you start the clinical findings, immediately better to get rid of the wisdom teeth. And who are all flying to abroad also, they can just check before graduation how the wisdom teeth is erupting. If it is going to create a problem before the next visit, or if it is next visit, till the next visit there is no problem, means you can directly fly for your education, and in the second visit you can undergo the removal of the wisdom teeth. The only advantage of retaining the wisdom teeth is we can transplant the wisdom teeth. Whenever if there is any possibility, when you remove the first molar, we can transplant that one to this area, and If the wisdom teeth is erupted properly and helping in the function, then retaining the wisdom teeth is the ideal solution. But 90% of the people is landing up into the some or other complications, better to remove. And post removal of the teeth also, the complications are very minimal nowadays with the sophisticated technology and experienced consultants. That's why better to get rid of the wisdom teeth without any complication.